Hey guys, my name is Ava Ross and I'm here today interviewing the coroner of Butler County, Ohio, Dr. Mannix. Dr. Mannix, how are you today?
I'm great, thanks.
Are you ready to get into it?
Yes, let's do it.
So, my first question is, what does it entail to be an elected official for the coroner job?
Well, in Ohio, 86 counties have an elected coroner, and 2 counties have an appointed medical examiner. Whether you're the coroner or the medical examiner, you have to be a physician in good standing and take continuing medical education on death investigation. Then the coroners who are elected go through an election cycle to be elected, and our job description comes from the Ohio Revised Code, section 313. We investigate deaths that occur under suspicious, unusual, or unexpected circumstances. We investigate homicides, suicides, traffic fatalities, other accidents, fatal drug overdoses. Those are all the type of deaths that we get called on.
Interesting. Can you describe an average workday?
No,
There isn't an average workday.
there's not an average. Some days I go to the morgue and oversee cases. Other days I come to the office and do paperwork and meetings. There are political activities that I have to attend. There's medical education courses that I have to participate in. Sometimes I'm out in the middle of the night on a scene. My investigators have access to me on evenings and weekends because we cover the entire county 24/7, 365 days a year.
Wow. So it's just a non-stop job.
It is.
So when you're working, well, does this question count? Did you like this one?
Yeah, I can comment on it.
Okay, cool. So, when you're working to create a change in our community, what other officials do you work with and how do your roles coincide?
It's pretty interesting, the overlap of the coroner's office with other elected officials, both at the county level, at the city or municipality level. So most of our interaction is with law enforcement, whether that be the county sheriff, the local police department, Ohio State Patrol, or even the Attorney General's Bureau of Criminal Investigation. So all of kind of the legal law enforcement agencies is who we work with. We also have interaction with the prosecutor's office if we get called into court, or the clerk of courts if we're called to testify in a case. And then the coroner works on several prevention initiatives, trying to figure out how we can prevent deaths. So there's lots of community partners, whether it's the health department, hospitals, EMS, fire, the mental health addiction services recovery board. All of those agencies are partners with us in trying to better the lives of Butler County citizens.
How often would you say you get called into court?
I personally don't get called very often, but my forensic pathologist does on pretty much all the homicide cases.
Okay, interesting. So when you were in school, were you aware of this career path?
In school, I had no idea this was a career option.
So how did you sort of get into this? Did you go to college for it? Like, what was your path?
My husband and I were involved in local politics. We met other elected officials at the local level, county level, and even state level. When the previous coroner was ready to retire, because the qualifications for coroner are so strict that you have to be a physician, some folks reached out to me and asked if I would be interested in this position. My philosophy in life is say yes.
Say yes.
And then figure out how to make it happen.
Oh, okay.
So I said yes. And it's been a good career change and a rewarding decision for me. Learning the job was mostly on-the-job training. I have an amazing staff. Many of them were already here when I became coroner, so I learned a lot from them, and then some of the additional courses and training that we receive as coroners. So that's how I became aware and then learned the job. It lets me combine my medical skills with community service.
So what did you go to school for? What did you major in college?
So in college, I majored in biology and then attended the University of Cincinnati for medical school, where I got my medical degree. Then I trained as a neurologist and practiced as a headache specialist for 15 years before becoming the coroner.
Wow. So did you do any volunteer work, or you mentioned you were active in local politics? Can you sort of explain how you were?
Sure. I was interested in what was going on, how our community values were being supported, what the people who ran our local municipalities and county, how they were spending their money, my money, your money, the taxpayer money. And so we attended certain events, certain activities to see what was going on in the community. And that led to a lot of networking and introductions, and helped me know kind of what the political scene was. And then I was able to add my medical expertise to that as well.
That's cool. So what was your election process like?
To be elected as coroner, first you get signatures from Butler County voters on a petition. That petition is submitted to the Secretary of State and approved for having enough signatures. There's some fees that you pay in the process, and then go through the primary election. The coroner position is a partisan position, so there's a primary, and then the main election in November. The coroner's position is a 4-year term. We run in the presidential election cycle. When I first became coroner, I actually was appointed because the previous coroner retired early. But then I've run 3 times unopposed, and I plan to run again in 2024.
I had a really good question. Oh yeah, so you mentioned a petition. Hold on, wait.
Scratch my nose. Okay.
So you mentioned the petition. What is the petition for exactly?
The petition states my intention to run for the office of coroner for a set term, and validates that I am a Butler County resident and in good standing to run for the office. And then the signatures show that 50 or 100 Butler County voters have acknowledged that I have the qualifications and am submitting my name to be on the ballot.
Yes. So you were appointed first. Have you ever run against anyone for coroner position?
I have not had any.
That's pretty cool.
Yeah.
It means you're good at your job.
It's a unique position because of the physician requirement, and it's a political position, and some physicians are not of political bent. So, and not everybody can deal with dead bodies.
Yeah, I can imagine. I don't think I could.
So it's a pretty small field of people. Some other counties do have contested races. Some of the larger counties where the position may be a little more politically influenced.
Politically influenced. So is your role nonpartisan?
Well, I do run on a ticket, on a what do you call it?
A ballot?
Yeah, but as a party. So I have a party affiliation.
Oh, you have a party affiliation.
So I have a party affiliation when I run. My day-to-day job doesn't feel very partisan.
Yeah.
Obviously, I'm responsible for doing the work in Butler County, being fiscally responsible. One of the other elected agencies that we work with is the Board of Commissioners, because they oversee the budget for the county. So the way that I spend taxpayer money to do the work that my office needs to do has accountability at the commissioner level as well. So it doesn't feel very partisan, but that's how it's structured in Ohio.
That's cool. So what is one thing that you've done in your career that you just think is like really cool? Like, what are you super proud of?
When I became coroner, the processes of the office were a bit outdated. So I've worked with the staff and with the IT department to update our computer system. At the time, there was multiple data entry by multiple people in multiple places. We've developed a system that allows data entry, single data entry in real time, accessible by other people. My investigators have laptops that they can go to the scene and actually enter information from the field. And then the reports that we produce come out of that system. So it has made us more efficient in what we do and modernized the office. The other accomplishment that's in process is currently my administrative office and the morgue are in separate locations.
Mm-hmm.
That's challenging for staff who maybe have to be at one place and at the other place. It's inefficient, again, in terms of people. And so I have been working with the Board of Commissioners, and we are starting the process of building a combined office and morgue facility.
Wow.
To serve the citizens of Butler County.
Is it going to be here in the Government Services Center, or?
Yeah, it will probably have to be on a different location if we build from ground up. And COVID also kind of influenced both of those accomplishments. When COVID hit, all of my staff had computer access. We can't really work from home, but we could continue the work that we needed to do. We were not shut down because we were all linked into our case management system. The other thing that we learned in COVID was the county needed more cold storage in case of, for example, a mass fatality where there were a lot of bodies. And so the new morgue will provide more cold storage so that we can handle a potential crisis like that better.
So how did you guys continue operation in COVID? Was it really, really difficult?
Well, we had to, right? And so we did what we needed to do. We made some staffing adjustments in terms of schedules so that we didn't overlap and potentially have everybody exposed at one time. We made modifications at the morgue in terms of safety. We upgraded airflow and some of our safety protocols. And we can work remotely. Most of our work is our communication among each other is by phone or on the computer. But we still had to go to scenes. We still had to pick up bodies at the hospital. We still had to continue our work. So I'm very proud of what we were able to do, because people don't think about what the coroner's office does, what our role is, but it is important in a community.
Yeah.
And we were able to do that pretty seamlessly and without interruption.
That's cool. Well, thank you so much for meeting with me today. I really enjoyed it.
Sure.
Thank you.
I hope that gives you a little insight into the coroner's office.
Thank you. I know, I told my best friend that I was meeting with you today.